I came to the day hospital when I was in a suicidal depression, and I got the referral from my psychiatrist, and it was 3 weeks that changed my life. I learned what to do with my depression. I regained hope, and I'm here today because of it. The biggest change for me, we all kind of know generally what the coping skills are, but being able to implement them when you're in a depression is like pulling teeth from a baby. It's very difficult to do because you don't have any motivation to do anything. So coming to the day hospital forced me to get back into a routine of just simple self-care, sleeping normal hours, being awake, taking care of myself, eating regularly. And it gave me a purpose every day. And so in those 3 weeks, it helped me regain my normalcy, so that by the end of it, I kind of was like, okay, I see the value now of the little things and the impact that they have on my life. It was new and it was different because everything else has been, you go to see your counselor once every 2 weeks, or you go to group once a week, and it really wasn't enough to make a difference when you're in a major depressive episode. But this, being new and being different, I was excited and scared out of my tree. But I did it, and it really made a difference because I didn't have to wait for my next appointment, and I just had to wait for the next day. And in the day program, if I was having a difficult moment, there was always someone I could talk to. I didn't have to wait for my scheduled time with my psychiatrist or my counselor. It was accessible, and it still is, because if I have a hard time, I can call them, even though I'm finished the program and I have someone to talk to.
We've been open 10 months today, actually, January 7th of 2019. Since then, we've had 400 patients enrolled in our program. The intention is to be a cost-effective alternative to inpatient hospitalization. So we help patients transition, and we address a really acute population in terms of their mental health needs. So patients coming to us are generally quite acutely ill, requiring high-level mental health support coming in. So our staff are definitely trained, well-versed in dealing with those high-risk, high-crisis type situations. They are inpatients, but then they get to go home at the end of the night, right? Sometimes inpatient hospitalization isn't necessarily the best thing for those clients, so they're able to come here, get the necessarily skills and tools they need to work through, let's say, certain negative emotions or negative thinking, and then they get to go home at the end of the day and practice those skills, come back the next day, work with our teams, and engage, and then kind of go back and forth and see where they're at.